All right, welcome to the Sweet Science of Fighting podcast. Today we have the combat therapist. Thanks for coming on.
Thanks for having me, mate. It's good to chat.
So, if you're wondering why there's no video to this podcast this week, it's because the combat therapist has decided to remain anonymous for this podcast, but maybe we'll get a reveal in the near future down the line. But maybe for the listeners, you want to give them a little brief background about yourself.
Yeah, so basically started off like when I was younger. Played pretty much every sport under the sun, but my main sport of choice ended up being soccer or football, as some depending on what country you're from. Played that at a semi-professional level, and then from there I had a serious shoulder injury, so I landed on it, had a shoulder dislocation, and that's probably where my rehab, my love for the rehab side of things came into play. It was actually from a bad experience that I had. So at the time, I was training at a few professional clubs. During that time, I was training with the youth squad at Melbourne Victory as well as Melbourne City at the same time. And when I had that injury, like I had a very, very, very poor rehab process, and I don't want to use that as an excuse in terms of the career path that I was going down, but I do think because I wasn't a talented athlete, I had to work really, really hard, and having that time out of sport just played a massive role in, I think, not being able to pursue the things that I want to do. So obviously, there's a big emotional component as to why I'm doing what I'm doing now, because essentially, I don't want anybody else, regardless of if you're an elite athlete or just a general pop person, to go through the things that I went through from a rehab standpoint. So that's essentially the background of who I am, what I do. Now I've got my main interest is in combat sports. The reason for that is I just think the movement variability within that sport, and just whether that be grappling, whether that be striking, the demands of the sport, there's just so much movement variation. You need to be in prime condition as well. So from a rehab standpoint, it's a very, very challenging sport to get people back into pretty much like it is probably the best reflection of human movement out of any sport that I've seen. So I was like, well, what's a sport that I can transition into that I think that's going to be a challenge, because it is a challenging sport to learn about, because it's just so it's a very, very complex one. So that's essentially why I went down the combat sports route. I think it's really, really good from the personal development and mental standpoint as well. So that's essentially my background in a nutshell.
Awesome. I want to dive into a little bit then. What made your rehab stint so poor then from soccer that essentially did, I guess, change the trajectory of your whole life to go down this path?
Yeah, so I had like a partial dislocation within my shoulder. Did like a bunch of I followed the rehab protocol to an absolute T. Like I did absolutely everything I needed to do, to the point where I thought like, is it just me? I can't get better. But long story short, first instance, I had like 3-4 months of consistent rehab stuff. I was going into the clinic every week, every 2 weeks, doing the progressions. It was mainly just like light dumbbell stuff and TheraBand stuff, which is like still the common theme within a clinical setting. But after that, they decided, okay, well, maybe we should get some imaging done. Had one MRI done. Nothing came back on the result. Then I continued to go through that rehab process because I was like, oh, well, there's nothing on MRI, so we'll keep going through it. That was another 3 or 4 months. Then I decided to get a second opinion from a sports doc. He immediately saw on the initial MRI that I did that there was some discrepancy within the labrum. So then they're like, well, you need to get another MRI, this time with a dye injection. Came up, had a third of my labrum torn. So it was just a massive, massive waste of time where I was trying to fix something that, and in my opinion as well, like the rehab that I was doing was not conducive to me getting back to elite sports. It was conducive to me if I was a geriatric 70-year-old that wanted to play lawn bowls again, but not if I was wanting to, because I was playing fullback as well. I was throwing the ball in, all of these sports demands, but I wasn't doing anything over like a 1 or 2 kilogram dumbbell. I had no strength conditioning, had none of that robustness inbuilt into my programming. So yeah, it was just a massively delayed process. I wasn't working towards any adaptation that was susceptible to any change. But like knowing what I know now, I probably didn't even need the surgery, because I had to get surgery as well. So then not only did I waste 6 to 10 months prior to the surgery, I wasn't even stronger before the surgery itself, but then I had to go through almost like double the rehab process
Yeah.
because I had the labral repair, and then I had to start from square one going through all the rehab.
Oh. So what I guess what would you have done then instead of the light TheraBand, light dumbbell work to get yourself back?
Yeah, good question. So like if I was in the exact same position I was in now, and me trying to take a conservative approach, what I would be doing is because I was quite young at the time, so I don't remember the exact presentation in terms of like my aggravating factors, pain, and things like that. It was more of a stability issue. So
Mm.
first and foremost, I'd be looking at things such as, depending on whether I was still on the pro scene or not, I'd be looking at BPC 157. I know like
Oh
Grant
yeah.
Fowler, yeah,
I've heard that since a friend of mine mentioned that I think
yeah,
2 or 3 weeks ago. I swear I've heard BBC 157 literally every day
yep,
since.
yep.
But
So
it's banned, right? For athletes.
I think so. But if you're like a recreational athlete,
Mm.
I think it's fair game. It is a peptide, but the thing is, it's found in your gastric system. So most of the side effects that have been studied are mainly just like gastric upsets because it's already found in your gastric system. So yeah, probably like if I wasn't playing professional sports, I'd be utilizing that. I'd be working on and this is sort of the approach that I take with any rehab protocol as well. Applying the most amount of load and most amount of adaptation, whether that's strength, hypertrophy, whatever the case is, based on my aggravating factors. So I'd be working into near pain-free ranges or slight discomfort ranges within external rotation, internal rotation, working on because if we look at the labrum as a construct of the shoulder joint, all it does is deepens the socket slightly. If it's the hip, different story, but the shoulder, like you've got so many surrounding structures. You've got the rotator cuff, delts, lats, pecs, all of these structures attached to the shoulder. So if you get those strong, you can help stabilize the shoulder. And that's
Mm.
what I missed completely. I'm never going to get any adaptation through any horizontal pulling, vertical pulling, horizontal pushing, horizontal pulling if I'm doing 1 kilo a pink dumbbell at rehab.
Yeah.
So yeah, a ton of different stuff I'd be doing. I'd even start like because the biggest thing that I had an issue with was overhead throws. So I'd even be doing that at a super lightweight, starting to build that stability. If you don't train the mechanisms in which you're having issues, you're not going to. It's not going to be able to. You're not going to be able to rehab it. It's just
Yeah.
most of the time, everything I do with every single client is just it's super logical. It does. It's not a crazy out there approach to things. It's just like I've created good systems to help reverse engineer specific injuries.
I know Bill Knowles in the States, the ACL guy.
Mm.
Um, a presentation of his, he kind of looks through a similar lens, and he had, I think it was a top skier do an ACL, and they got back on the skis. I think it was like 2 months after surgery,
Yeah.
and he was saying things like, "That's where they're most comfortable. Why wouldn't we go back to that and start strengthening it through those movements?" You know, it's a similar philosophy.
Yeah. And I can appreciate timelines and things like that. It gives, because the thing is, the biggest question that people have is like, how long is this going to take? Obviously, it's very, very hard, but I'd much rather work with the philosophy of I want to give you as much, the highest probability of getting you back to doing what you want to do as quickly as possible.
Mm.
The timelines that you get from your orthopedic surgeon and things of that nature, that's just a rough guide. But
Yeah.
if you're willing to put in more work, and you look at elite athletes as well, they get back to X, Y, and Z so much faster because they're obviously doing a ton more than somebody that can only. And I understand like people have different priorities. Some people don't. That's not their number one priority. Getting back to doing a certain sport or things like that. It might be the slower approach to healing might be best for their lifestyle, but I'd much rather and much prefer working with people that are really, really adamant on getting back to doing things.
Yeah, for sure, and I guess that way as well with your philosophy on it, is it bridges that gap between the rehab you're doing and then the activity or sport that you're doing. Because often, as you mentioned, TheraBands and pink dumbbells, and then go, oh, okay, it's better now. You can go straight back to whatever you were doing, but you haven't trained anything in between.
No, and I think it's within the physiotherapy context as well. I think that's a really big gaping hole within the industry. It's like we've got strength and conditioning coaches who are really good at building high performance. I think for the most part, if you're a good S&C coach, you can probably do a better job at rehabbing somebody back to their sport versus a run-of-the-mill physio within a clinical setting. Physios are really good at diagnosing, but we've gotten to the point now where, for the most part, if you really need a clear diagnosis, you can just get imaging done. So obviously, all the assessment tools that you have at your disposal, they're important, but who gives a fuck what the diagnosis is if you can't get somebody, if you don't have the skills to get somebody back to what they want to do?
Yeah.
That's the biggest issue that I had. And I was like, as soon as I started my career, I'm like, I pretty much need to be a S&C coach as well if I want to actually be good at what I'm doing.
Yeah. And rest can't be a prescription for for all these injuries.
No, neither can like ibuprofen until you're pain free, like, which is the
Yeah.
the common like that was what I was taught. You need to take, just get them at the acute stage of their pain, get them to take Nurofen for the first week, and it's just like it's such a
With bed rest.
it's such a recipe based approach that just there's no creativity there either.
And then you also got to add ice to the injury too every day.
Exactly. Even though the doctor that advocated for that has gone against, it's just like,
I saw
and
that
that's
recently.
the thing, yeah. And that's the thing as well. Like, if you are this is just something for any young, could be S&C coach, physio, anyone in the rehab space. Like, if you learn off the right people, you can fast track your progress beyond what people like. There's people that have had 10, 15, 20 years in the industry, but they're not willing to learn more because they're still following the same recipe that they did once they graduated. So and that's the thing as well. It's all about the results you get for people. If you've got a year in the field, if you've got 10 years in the field, it does not matter. It's purely based on the results you're getting for people, in my opinion, anyway.
Yeah, for sure. Actually, because most of the listeners on here, I guess you could say amateur athletes, amateur fighters, people who maybe don't compete or just can't kind of compete locally, or even some to the professional level.
Yeah.
Touching on that idea of icing injuries, you mentioned obviously that the person who came up with that idea has kind of backtracked on it. Do you have any more information on that for the listeners? Ice injuries, don't ice injuries, anything like that?
First 24 hours, ice it. But beyond that, you're much, much better off mobilizing the area as much as possible. If we look at let's use the classic ankle sprain as an example. If we look at the swelling around the area, if we utilize venous return and the calf muscle pump that we have available to us, that's going to give us further benefit of lymphatic drainage versus just icing the area. It can actually make the joint feel stiffer if we keep icing it. And people don't realize that for you to actually ice the area correctly, you need to get your skin temperature down to 13 degrees Celsius. So for you to be able to do that, you need to pretty much put the ice directly on the skin. And you can't do that for a long period of time to where you get, because then you're going to get just like ice burns and shit like that. Yeah. So it's like, you got to look at the opportunity cost as well. It's like if your goals are getting back into moving, you need to start integrating that as much as possible. Like, say if I was to get an ankle sprain today, what I'd be doing, like first 24 hours, I'd be icing it. Compression is obviously a good thing as well. Same thing, it helps drain the fluid back up towards the heart so that it can just help with circulation. But I'd genuinely be doing like thousands and thousands of repetitions in dorsiflexion, plantar flexion, eversion, inversion, and just getting as much movement through that area. The biggest thing that people don't realize with pain is it doesn't equal actual tissue damage. It's perceived threat. So what's the best way to remove a perceived threat? It's by moving the area more. The more you move the area, the body realizes, okay, it's actually safe for me to start dorsiflexing and plantar flexing the ankle. I'm not going to create further tissue damage, and I'm not going to injure myself further if I do these things. And then that helps more than anything else to bring that pain response down. So that's free. Moving the ankle is a free thing. You don't need all these like ultrasound therapies and things like that have been disproven as well. So does that answer your question?
Yeah, definitely. Yeah. And for anyone listening who's maybe hearing terms like plantar flexion, dorsiflexion, etc., just move your foot up and down, side to side.
Move it in circles, and like that's And then you just slowly integrate like a calf raise as comfortably as you can. Start with 2 legs first, because 2 legs is easier than 1 leg. Once you can do 2 legs, progress onto 1 leg, and then just work through the sequences that you need, depending on your sport as well. Like, we want to restore range first. The best way to do that is to do that without having any weight on the area first. then you start weight bearing it and you just progress it along accordingly.
You mentioned about the ultrasound thing. Obviously, yeah, physio clinics love having it because it's, I guess, it's a fancy tech. Don't have to do much. And as you mentioned, it's been disproven. Do you want to maybe jump a little bit into that? Because yeah, I've had plenty of ultrasound from physios in the past, and yeah, I've sat there thinking, what the fuck is this going to do?
Yeah.
And it's done nothing.
All it does is it heats up the area. Like it's even when I was studying as well, that like they're like, yes, clinics have this, but it does sweet nothing. So yeah, and that's the thing as well. I think the most important thing to note, and I think is where people go too far down like the evidence-based route as well, is like if there's something that the client feels helps them and you do it and they feel better from it, then it works. It doesn't need to be over like a big systematic review that says, no, it's been disproven. Like if somebody feels like, as an example, someone thinks massage is going to cure whatever injury they have, you'd be stupid not, as a therapist, you'd be stupid not to use that and have that in your back pocket, because perception of things that help are just as important as the evidence as well. It's using your clinical experience combined with the latest evidence. Like that's a good practitioner. No, actually creating the plan based on the person in front of you.
That makes sense. I want to throw a bunch of topics at you, and you can just kind of pick whatever and go with it.
Yep.
I know you're active on Twitter about some of these topics as well, and obviously some of them, I guess, are just things that are repeated day to day within sport. So things like foam rolling for recovery and, I guess, flexibility, static stretching for flexibility and recovery. I've got a couple more. I've got tight muscles and pain. I've got functional patterns, or I like to call them fictional patterns, and GOATA. There's 5 random topics. If there's anyone that interests you, jump in and you can start riffing on it.
Well, let's go down the line, because I wanted to share this on Twitter as well, because I think we can cover a lot of things and a lot of myths within the health industry within just this one podcast. So if we start with foam rollers as an example, I prefer to use foam rollers for certain exercises. So co-contraction stuff, getting your hamstrings, calves, glutes to fire at the same time. I think it's a much better tool for that versus people say like, I think the big precipice around foam rolling initially was like it breaks down scar tissue and things like that. There is no way in hell that foam rolling a muscle is going to break down any sort of adhesions. So it's akin to just pretty much putting a rolling pin up and down your leg. But I want to put this as a caveat with everything that we discuss, like each of these treatment tools, whether that be massage gun, foam roller, whatever the case is. If you use it and you feel better as a result of using it, then who am I to tell you that it's a shit device? Like if you get benefit out of it, utilize it. But just know that there's other things out there that can also help as well. So that's my opinion on foam rolling. It can be a good way to sort of warm up the muscle as well by rolling over it. You can work on trigger points as well to get some neuromodular changes as well. So you're not actually changing the muscle structure. You're more so changing the nervous system's response by pretty much overstimulating it by either trigger point release with a lacrosse ball, massage gun stuff, and foam roller stuff. Those trigger points that you're going through, if you work, and the thing is, you can use a lacrosse ball for like 30 seconds max, like doing 2 sets of 30 seconds on an area, and that's enough. You don't need to spend, like if you are spending 20, 30 minutes on a warm-up routine before you're working out, before you're in the gym, then your programming is just piss poor. Like it's simple as that. You should not need, all of my clients do a warm-up of at least like 2 to 5 minutes tops. And most of that's just getting some movement patterns reintegrated back in. So I think, having to warm up and use all of these devices, it's very, very overrated in my opinion. So
the Donnie Thompson body tempering, if you're aware of that, the one where they have like the big 40-kilo metal roller that they just lie on their hamstrings. I'm assuming that's similar mechanism. Then it's just kind of down regulating the nervous system.
A lot of quick instantaneous changes occur within the nervous system structure. So similar concept as well. Yeah. But yeah, like that's the thing is, all of these tools have pros and cons, and if you understand how each thing works, then you can choose whether you want to utilize them or not. I'd much prefer to warm up with specific movement patterns. So like being able to be in a good squat position, being able to move through various ranges that I want to target. Like that's more important to me as more so like movement preparation for what I'm going to do when I start adding resistance and load.
Yeah.
So that's foam roller. What was the other? So you had like
Static stretching.
static stretching. I think has had a lot of hate unnecessarily, because I think if you don't have passive range, and I was somebody like 2-3 months ago, if you asked me this question, I would have said, yeah, static stretching is pointless. But I do think it has its place, because what it does is if you can't hit a position statically, you can't expect to hit it actively. So it's one of those things that you can utilize in your toolbox. I think it's had a lot of poor reflection on that modality, because there was a study that was like they did static stretching and then they did a sprint after it. Well, no shit, your power output's going to be reduced. Like, how many people are static stretching before they do it?
And I think it was like
an
10 minutes,
sprint?
wasn't it? A 10-minute
Yeah,
static stretch and then having to jump or sprint with nothing in between.
exactly.
Yeah.
So it's like anybody that does, regardless if you're static stretching or not, you're going to feel like shit going straight into a sprint like that. So I think it's good static stretching is good to get into certain positions you otherwise can't get into actively. But I much prefer the way that I program as well is like integrating almost like resisted stretching with the things that I do. Use it as an example, like standing calf raise machine. If you work through full range, you can get a really, really good eccentric dorsiflexion, so toes up stretch when you're doing that. So instead of you having to do that statically, why not do that under actual resistance? Change the sarcomere length, make all of these adaptations that will be long lasting. Because once again, static stretching is more so a neuromuscular adaptation. So I'd much rather get a neuromuscular adaptation as well as a change in true muscle length if possible.
Yeah, I do the same thing as well. I've got almost had loaded stretches for almost every joint in the body with that. And I mean, yeah, as you mentioned, like static stretching can be good, help you relax at night as well, but you don't get the structural changes. Like if you were doing a standing calf raise and holding that bottom position loaded, you're getting structural change too. Plus you're getting a little strength at that length and a whole bunch of other things.
Yeah. And when it comes to training, we want to be as efficient as possible. If we can hit multiple parameters within one exercise, why would we not do that? So and it all depends on your time availability as well. But that's the approach that I take to stretching, is like, how can I mobilize giving somebody as little as possible? And then you just build layers on top of that, depending on what their needs are. Obviously, some people need certain accessories more than others. And it goes down that positioning.
Nice. Should we touch on what was my next one? Muscle tightness and causing pain. So obviously, the typical is your lower back sore because your hamstrings are tight, or your hip flexors are tight, or whatever it is.
Yeah, I think that's absolute bullshit, and it's been dispelled a lot. I think the best way to cover this particular component is, I think everyone that's listening, number one, your posture doesn't cause pain. Really important to note. Number two, one specific structure in your body, one specific muscle in your body is not going to cause things further up and down the chain. It's a lot more complex than that. We even look at, as an example, say, tight hamstrings, I stretch my hamstrings, that's going to help my low back pain. What about the other factors, like how you're sleeping, what your dietary measures are like, what your body's like as a inflammatory environment as well, because that's going to help and create a more hypersensitive environment conducive to pain. What are your stress levels like at the moment? Like, these are all factors. Are you sleeping 8 hours a night? These are factors beyond just a hamstring stretch. So for people to just say, oh, yep, you've got a tight hammy, that's why you've had low back pain for the past 10 years, is just a very, very small lens and microscopic approach to the big picture. Yes, it can potentially contribute, but there's so many more factors when it comes to pain. Like, there's even just, I think the biggest breakthrough that I've personally had with clients that I work with is them actually understanding how pain works and understanding their injury. Once they have those two things, it helps de-threaten the injury response as well. Because if you know that you're not going to get worse by starting to load things up because you've been educated as to how the things work, then that in itself helps massively. So there's a huge psychological component to injuries as well. So it might, having tight hamstrings biomechanically might be putting more pressure on the low back, but it's not the only thing that you need to look at in isolation. So the way that I like to, like my philosophy of rehab, there's a lot of pain science people and there's a lot of purely biomechanic. I like combining the two. I think you need to understand one to understand the other as well. Biomechanics, yes. Can we offload some of that pressure through the low back by lengthening structures through hamstrings and dispersing load more evenly? Yes. But that's only one part of the picture. There's also the pain science side of things that needs to be addressed as well.
Do you want to dive a little bit into that pain science? That's something that I've been meaning to read more into. There was a book recommended. I can't remember what the book was called.
Explain Pain or something?
Yeah, something like that. I
Yeah.
haven't actually got it read it yet. But do you want to maybe just dive in a little bit on that?
Yeah, for sure. So this is essentially, I've learned through a lot of, like, Greg Lehman's a really good resource for pain as well. Like, he's got a lot of really good views regarding pain science. I think it's really important that, just to start with, like, I don't like when people educate people about pain, saying like, yeah, it's all in your head and things like that. But I think, like, even understanding how pain works can have a massive influence on your rehab timeframes as well. Because I think the most important thing, like, if I was to give somebody like one piece of advice to make it just as simplistic as possible, so they didn't have to go and do further readings and stuff like that, is that pain it's a perception of threat. It isn't necessarily, when you have pain, you're not necessarily causing more damage to the area. I think that's a really, really important thing to note, especially for individuals who've had chronic issues. So if you've had a chronic injury, then it's less likely that when you do have pain when you're doing an activity, that you're actually causing further tissue damage. What happens is, when you get injured, the area of injury becomes more sensitive to the same stimulus. So it's almost like, so the body can't dissociate. Say, for example, you've got an alarm system at your home. It can't dissociate whether there's a cat that set off the alarm or if it was an actual burglar. So it's the same signal, but the threat is completely different. If you've got a cat in your house versus having a burglar in your house, it's going to be a lot different. So I think the biggest thing from a pain standpoint is learning that it is a perceived threat. And it's something that, if you've had chronic issues, you might have to work through slight bits of discomfort. But a really good metric that I like to utilize with a lot of people that I work with is, you get the 24-hour pattern in particular. Like, how does it might be a little bit uncomfortable during the actual session itself, but how's it pulling up the next day? If there's a slight bit of discomfort, that's fine. Obviously, if it's more intense than it was as you were exercising, that's a different story. And I think it's an area within rehab that needs to be further consolidated. Like, pain's a very, very hard thing to educate and explain, especially when you have got like a 20-minute consult, which I used to have when I was working in a clinic. I found it really, really hard to get the message across without it sounding like, oh, it's all in your head. So it's a really, really hard topic to discuss, but I think there's becoming more and more available resources to learn. Like, Greg Lehman's a really, really good resource. Jared Powell, who's the shoulder physio, talks a lot about pain as well. So there's so many things. Like, people think, oh, if you've got scapular winging, that causes pain. That's been disproven as well. Another thing that I tweeted about yesterday was subacromial impingement. Doesn't exist anymore. People with shoulder pain that have those impingement symptoms actually have larger subacromial spaces. So it's like, well, if it's impinging but the space is bigger, how does that work? So there's a lot of
So what's the cause of that pain then, if it's not an impingement?
It's more so, well, it's obviously the stuff that I was just describing before, like the sensitivity stuff, but it's more so just like, if you get the shoulder stronger globally in general, then you're going to have better outcomes than focusing on specific scapular mechanics and things like that. So it is, when it comes to exercising any injured area, a lot of it has to do with like just being able to give yourself more movement variability and variety, as well as getting the area stronger. If you can do both of those things, then it's going to help. It's pretty much, the way that I explain it is, you have to prove to your body that it's safe to do something. Until you do that, you're still going to have remnants of pain.
So if I sum it up briefly, it's almost like pain does not always equal structural damage. You can have pain without structural damage, and that's just a perception of threat that you're just going to have to work through.
Correct. And I think that's the biggest thing to note, is you might have pain in an area, but if you think about it, like, and if you're hyper focusing on anything, this can be injury related or not. But if you're hyper focusing and worrying about, oh, I've got pain in this area, I've got pain in this area, if you constantly rewire your thought process into, of course, the area is going to be more sensitive. And most of the time, and this usually happens near the back end of the phase when I'm working with someone, is they end up completely forgetting about the fact that they had the injury, because that's the way I structure things. The first time we talk, we discuss your injury. After that, I'm never asking them, oh, are you in pain? Are you in pain? Because it's focusing on the wrong things. I'd rather focus on what the individual can do versus what they can't do. And I think rehab itself is a really shitty term, because I think drug and alcohol addictions. So it's already like it's framing everything in a negative fashion to where you're broken, where you're not. It's just like there's a few things you can't do. If you train intelligently, you can definitely get back to doing them in most cases, unless there's something significant going on.
That reminds me of I think it's Franz Bosch. I don't know if it was philosophy. I don't know. It definitely didn't come from him, but I think it was mentioned as something he did. But for example, in rugby, maybe a player has ACL injury and they're maybe doing some like single leg balance or whatever it is, by having them pass the ball back and forth while doing it, now you can't concentrate on the knee or the leg. Now it's on the ball. So then you can do these tasks and kind of forget about that perceived, I guess, threat of something happening.
Yeah. And the more an injury influences your life, the harder it is to rehab. So I've worked with people, for example, it's affected their work, ability to earn income. It's affected their relationships as well, because they're stressed out because they can't earn income. So it's not just the injury; it's the emotions associated with the injury that causes further issues. If you look at a lot of chronic injuries and you speak to these people, it's more so their injury has had a massive effect on their life. So I think we always go down the lens of thinking, oh, yep, this structure's causing X, Y, and Z, but it's so much more than that. Even just looking at the psychological components of how much an injury affects somebody can make a massive impact on their rehab timelines as well.
Those are all good points. We've got a couple more. We'll probably have more as well after these anyway, but I guess we could lump them in the same category, couldn't we? Functional patterns and GOATA.
Yep. So let's start off, because I know a lot of people just go straight into the negatives about these movement patterns. Let's start off by just discussing some pros of the movement. So the reason that they're in this industry, that like people are getting results from it, but I think you need to dissociate why that might be the case. So if we start with GOATA, like we're loading the knee. So say, for example, I've heard a lot of people that get improved knee symptoms using GOATA patterns. But if we look at the exercise mechanics in and of itself, a lot of it is working through, like they avoid a lot of pronation-based positions. So you're just going to be loading up, let's use the knee, for example. You'll be loading up the knee in a different variation. So when it comes to injuries and pain, movement variability is a really important thing. So it taps into that. Number two, it's almost like a deload, because you're never going to be able to maximally barbell back squat or even goblet squat in a GOATA based pattern if you're primarily in that outside arch position. So not only you almost got like a mini deload, you've got movement variability. On top of movement variability as well, they like having a play around with crawl patterns. I think especially for grapplers in particular, being proficient and being able to move your body through certain crawl patterns can be beneficial as well. The thing I don't like about both functional patterns and GOATA is the fact that it's like a fear-mongering tactic to get people into their training protocol. It's like, this is the only way to train. If you don't train like this, you're going to end up injured. You're going to fuck your shit up, which I just can't stand. Like any movement philosophy, Athlete X does this, Move U does this. All of these really big rehab conglomerates, they all do this. They're like, if you train in this way, you're going to be in pain. But look, we have the magic philosophy and cult that will be fixing your orthopedic injuries until you're 100 years old.
And the course is $1,000, and then you can get certified too.
Yeah. So it's like, it's a perfect pyramid scheme. But with functional patterns as an example, the best thing that I would take away out of that is like train some rotational characteristics. Like that's all you need. You don't need to you don't need to pretend and simulate striking with a cable.
Yeah.
Whenever there's exercises that are like, especially if they're geared around a certain sport, because I think functional patterns leans a little bit into combat sports in terms of their their
More
philosophies and
rapid.
stuff like that. Yeah. So anything where it looks like it's almost the sport, just fucking play your sport.
Yeah.
It's that simple. You should be getting qualities, especially as a combat sports athlete. You're training a shit ton in the first place. The things you should be doing in the gym are, number one, they should be keeping you in the ring or on the mat for longer. And number two, you should be getting things out of it that you can't otherwise get out of your training. That is the purpose of it, especially if you're taking combat sports seriously. So it's like half of the functional patterns movements, you're wasting a lot of time when you could otherwise be spending that getting better at the skills required for your sport, especially from a combat sports lens.
Yeah, definitely. I mean, always preaching that on the podcast and the blog, sport's always number one. Your training in the gym should complement that. And yeah, as you mentioned, if you're doing functional patterns movements, you're severely underloading
Yeah.
essentially every movement pattern. And then I can't even make sense of half the stuff they're doing. It's like a dance.
Yeah. And that's the thing, like these systems just give people other ideas that there's other ways to train, and I think that's a net positive. But saying that if you're not doing that, those movement philosophies is a detriment to your health is not a great. Like, I would never in my wildest dreams ever create a system that discusses those things whatsoever, because people are in pain. Like, you can't taking advantage of that and saying that your system's going to help that is just, yeah, especially if you're in healthcare. Like, the reason it should be the reason anyway that most people are in this field is to help people with their health. So you can yeah, if you're saying, oh, all the training you've done in the past has caused all of these imbalances, which, like, what the fuck does that even mean?
Yeah.
Oh, you're quad dominant. Like, I've had consults with people where they are just like listing off grocery lists of all of these deficiencies, misalignments, asymmetries that they've been told from therapists, which
Yeah.
it is completely normal to have asymmetry in the body. That's the most important thing that you need to note. And having that asymmetry may not be even causing your pain in the first place. So should we really be worrying about focusing on getting both your scapular mechanics the exact same, or should we just find a training style for you that you can tolerate and you can progressively overload in? That's my focus whenever I work with someone, not, oh yeah, your scapula's winging by 3 degrees, we need to address that. That's directly causing your pain. So it's like that's the way that I look at training in general.
Yeah, not everything has to be perfectly balanced, eh? Like,
No, not at all.
it's something that you can easily tell someone, I guess, oh, these things aren't balanced. That's the reason for X, Y, Z.
Yeah,
So then it becomes, I guess, an easy thing to kind of measure and try correct. And
yeah,
essentially it's a losing battle because you'll never ever get there. That's why you have a dominant hand and a dominant foot.
exactly. And you obviously want to be as objective as possible, but at the same time, like, is that objectivity leading them down the right path? Because I think some therapists do it as sort of an ego thing. They're like, they do the assessment and they're like, oh yeah, look at you can't do this, you can't do this. And then the first relationship you create with the person is like, you've just told me how shit I am at moving. Like, how's that conducive to them getting back to doing things?
Yeah, exactly. We actually have a question from the Twitter, from the one, I've retweeted your tweet anyway, but someone asking, it's a bit of a loaded question, really. What exercises do you recommend for huge scoliosis?
Yeah. So I get DMs all the time asking what exercise for X, Y, and Z. It's an impossible question to answer. And like, if it was that easy, I would just be like, I'd create a product for knees, ankles,
Yeah, exactly.
shoulders, low back, and be like,
exercises.
do this stuff, and the job's done, and I'd be out of a job in a week. So to break this, let's break this down more as a principle based thing. Scoliosis, number one, is you've probably had it for years and years. So if it's starting to cause your pain now, structurally nothing drastically has changed say last week you started having an onset of pain. We can attribute that to not to the structure of your spine, because you had, say for example, it's a developmental issue. You might have had that for 20, 30 years, and now magically it's an issue. You know what I mean? So with scoliosis, it's like, well, let's look at how the spine's positioned. Obviously there's some form of curvature there. So what I'd be doing is potentially working more. So anything that's axially loaded, so like barbell back squats, things of that nature, where we're getting that like downward compression, I might be preferentially using like unilateral exercises instead, just to offset and not have like a downwards force when our spine doesn't accommodate that.
Yeah.
Like that's one thing that we might potentially utilize. Another thing is just working on trying to get expansion through the more compressed side. Say we're bent to one side, then we might do, like as an example, like lateral dumbbell side bends the other way, adding some sort of inhalation component as well to help expand that area, and that might help disperse load through that compressed side of the spine as well. So for anyone with scoliosis, would be like finding somebody who is intelligently trained, intelligently can create a training program based on what your needs analysis is. It doesn't matter what the presentation is. You've got to find what's aggravating, what are things that help alleviate symptoms as well, do more of the stuff that alleviates, and then tweak the things that aggravate symptoms. So yeah, that's how I'd address that sort of presentation. And it's pretty logical in nature, but obviously the skill set comes with like, how can you turn a principle into a specific set of exercises, where I think a lot of people struggle with.
Yeah. What's your take on means of artificial recovery for combat sports, and I guess tips or advice for recovery for combat athletes?
Yeah. So are you talking like when you say artificial recovery, you're saying like all the Cybex stuff and
ice baths, sauna, cryo, whatever you name it.
Yep. All right. So if we look at whenever it comes to any system in general, I like to move the big rocks first. So I think you're better off investing time into getting an adequate amount of sleep. Like that's a natural steroid. Like why would you not put a lot of attention into improving that system as much as possible? Like that's number one. What's your sleep like? Making sure that your dietary intake is optimal as well. So obviously, if you're weight cutting, different story, but making sure you're in a slight surplus, enough protein intake, all of these basic things that people just overlook dramatically because they'd rather some of the sexier stuff like ice bath, infrared therapy, all of these other things as well. So it's like if you're not doing these two things first, you shouldn't even be worrying about the additional things on top of that. And then when it comes to specific other metrics, like you got to look at the cost of doing certain things as well. So sauna as an example, you're going to be exhausting the system, and there might be better ways to utilize that sort of central fatigue into your training instead. But at the same time, if it helps you feel really well rested, then it's like, who am I to say that utilizing the sauna is a bad thing? So when it comes to all of those additional like accessory based recovery metrics, it's like, well, if there's something that really, really helps you feel better, and like even like the research behind ice baths and stuff like that, from a recovery standpoint, it's a little bit up in arms as well. So, but I've taken them in the past, and I feel like the perceived lactate flush that I get after doing some of that contrast therapy, it feels unreal. So, and if you're in the same boat, who am I, or who are the people that are running studies to tell you that doing a certain rehab metric is a waste of time? If you feel genuinely so much better from doing something, then you definitely should do it, because it's like that. It's that power of that placebo as well.
Yeah, for sure. Other than, I guess, the typical sleep, nutrition, in terms of recovery, is there anything else, maybe advice, tips you'll give to a fighter to help them with their recovery, I guess, from training to training, week to week?
I think it mainly comes down to like how things are programmed as well. So I see a lot of MMA fighters in particular, because they need to meet the demands of striking, grappling. There's so much training they need to do, but I don't see a lot of people that have really intelligent programming on top of, because they're doing like grappling, striking, strength and conditioning. Like that's a ton of total loading throughout the week. So I think the biggest takeaway I would give to somebody who's like an amateur fighter that can't outsource these things themselves is looking to do some form of like high-low periodization. So having like a more intense day where you're doing, might be the gym session and the harder day of training, whether that's sparring, hard grappling, things like that, and then coupling that with a low day, which is like doing just drilling. It might be drilling positions on the floor. It might be just working on certain combinations with your striking patterns. Like that's a much better way to look at, because the way that I look at recovery should be complementary of what you're doing from a training standpoint as well. So if you really have to emphasize on doing absolutely everything necessary to recover, then maybe we need to second guess, are we training intelligently enough based on what we can currently tolerate? So it's sort of looking at things the other way around. I think, and it's the same process as what I said, like if you've got a 30-minute warm up, your programming and the way that things are structured probably isn't an intelligent way for you. And it's the same process with training as well, because we know like skill acquisition, we get better skill acquisition when we are more fresh. So if we can integrate that into our training on a low day, then we're getting multiple benefits. Like it's not just pushing yourself as hard as humanly possible. You look at Faraz Zahabi, he says most of his trainers are training at like that sub-maximal intensity, around 70% most of the time, and then they dial things up as they're preparing for a camp. And you look at, especially sports that you need to peak for, it's all about consistency. The longer you can stay training without getting an injury because you've just flogged yourself trying to do 2-a-days, trying to just absolutely smash yourself, you got to look at the bigger picture as well. Obviously, there's less time if you're near the back end of your career and things like that, but you've got to factor all these things in whenever you're structuring the way that you want to train.
Yeah. Oh, for sure. I've got, if anyone's interested in the high-low model, if you just search how to schedule your MMA training on Google, you'll find my article that explains it too. And as you mentioned with the training, I mean, the number one rule is don't train so hard that you can't recover. It's just about, again, planning it correctly, not staying in this middle intensity zone where you're doing strength training or strength conditioning, pads, grappling, or this middle intensity, just absolutely drilling you day to day to day to day. Because something will break eventually.
Exactly. Yeah, it's just that barbell strategy of investment. The same thing should be integrated into like any athletic training pursuit as well. It's like that middle area, you're getting a little bit of something, a little bit of nothing at the same time. So you've got to work at either end of the spectrum to just squeeze as many results as possible whilst minimizing injury risk as well.
Perfect. Is there anything else that we missed covering here?
No, I think we've covered a lot of misconceptions within the industry in such a short span of time. I think if anyone wants, from like a rehab standpoint, the biggest thing that I want to just hone in is like, there's a lot of things within the industry that look really, really glossy and sexy on paper, but I think things are transitioning in the right direction in the sense that people are starting to call out things that might not be the truth. So if you're seeing a therapist now, they tell you your hips are out of alignment and they haven't done an X-ray, that's bullshit. If they're saying that an asymmetry is causing your pain, unless it's like a true asymmetry, that's probably bullshit as well. Your posture doesn't cause pain. Your shoulder blades winging out a little bit doesn't cause pain. Like all of these things that are typically, like even some people feel worse when they're in that sort of military posture, more upright. Some people feel better when they slouch because it's more of a expanded position through the back of the spine. So I think, and that's what I'll be constantly reiterating when I tweet and talk about these things as well, is just like teaching people that it's safe to flex through the spine. It doesn't need to stay neutral the whole time. There's so many different things that and misconceptions that have just, I don't know, they're slowly heading in the right direction. But yeah, there's a lot of things that I think people think to be the truth, but it's not the case anymore.
You reminded me of one thing before I get you to plug your Twitter. Chiropractor, in terms of joint or spinal manipulation or joint manipulation, what is actually happening there?
Yep.
And can you actually manipulate a joint, I guess, when someone says you're out of alignment? Can you actually manipulate something back into alignment?
I don't think so. No.
Did I trigger you?
No, I don't think you can, because like even the if you look at the force production to truly manipulate a joint is like, the spine can handle up to like 2,000 pounds of force, which is just an insane amount of load. And I think that's like a really encouraging thing as well, because when you tell somebody that who's got back pain and they're like scared to bend down and pick up a piece of paper, you are very, very, like your spine is a very, very sturdy structure. What I think's happening when the adjustment process is occurring is like you hear the crack, which is just like a release of air pocket through the spinal area as well. Obviously, they are shifting the spine slightly when they're doing that as well, but they, like, from an alignment standpoint, it's not one crack session is not going to realign anything. Especially, you look at scoliosis people, like they have to spend, I think you can with like a smart training system as well, you can help mitigate the effects of scoliosis. But like this is over years and years of time. Like it's a lot of time
Mm.
invested. So if someone says to you, "Oh yeah, we just need to crack you," and we look at the chiropractic profession to begin with. Like I have no, there's really good chiros out there. There's really bad chiros out there. There's good physios out there. There's shit physios out there. So it's not like there's good things from each and every profession. Like if I wanted a spinal manipulation because that makes me feel better through the spine, I'd much rather get that done by a chiro who's done it thousands of times versus a physio that maybe does it like once or twice a week.
Mm.
So in terms of the like the whole alignment thing, it's like, well, they're not getting the chiros in general. Like that first started as like a marketing. It's a very marketing influenced profession, because from the start there was like Dan Kennedy, who's like one of the best marketing experts of all time, consulted with a lot of chiropractors, which have like that's now the model that still exists. It's the classic like we've got to work together for the next X amount of time. You need to get cracks like twice a week, once a week, and it's like a 3-4 grand package, and like they rely on that adjustment because they've been educated to say like, yep, if you don't keep coming back each and every week, then you're going to go out of alignment slightly, and we need to keep that alignment in place, which is complete bullshit. So like anyone that's being told that from any health professional, it could even be like physio saying, oh yeah, you need dry needling once a week, you need massage once a week to make sure that the muscle stays loose. That's bullshit as well. So I think that's the biggest takeaway, and what I don't want people to go through is being. And the thing is, like, some therapists just don't actually they're not up to date with the research, so they might not be saying things from an unethical standpoint, but they're still spreading misinformation about the service that they provide. So the biggest takeaway in terms of what I try and advocate and try and tweet about is just like giving you the no bullshit truth on absolutely every aspect of the rehab experience.
You triggered a few chiropractors listening
Yeah,
to this.
well, I've seen like there's a chiropractor on TikTok who doesn't crack anybody's backs, and like
Yeah.
he shits on the profession himself. I have nothing against chiropractors, but if you're just using spinal manipulation as your only skill set and you're not providing people with like a well regimented programming, all of
Mm.
these other things as well, then you're not doing a good job. And I don't care if it's the same thing with a physio. If you're giving people one or two shitty band exercises and saying, yeah, this is all you need to do to get you back to like high level football, rugby, whatever the case is, then you're doing a shit job as well. I
Yeah.
don't even want to pigeonhole myself as a physio, because there's a lot of things within the physio context that I disagree with as well. So
You mentioned about where maybe if like a physio or someone saying, you need to massage or try to keep your muscles, I guess, loose. A lot
yeah.
of combat sport athletes, I guess, blame lifting weights or whatever it is that they start to feel tight or they lose flexibility.
Hmm.
So from I guess your experience, your opinion, then what is it that I guess fighters can do to maintain that feeling of looseness or not losing, I guess, that range of motion?
Yeah, so I think when it comes to like range of motion lifting, I think it can definitely stiffen you up in general, but we also need to look at why that might be the case. You see a lot of people, especially let's use like the bodybuilders as an example, especially as they pack on a lot of mass as well, they start becoming more and more immobile. But I think it also has to do with an ego thing as well. Like people start reducing their range of motion within a squatting context. If you reduce that range of motion, then of course you're going to be stiffer because you're not working. If you work through less range of motion, you're not going to have more range of motion available to you. So it's a matter of like having programmed heavy stuff where you're just trying to move as much weight as possible. But also, what it's fine to squat full depth at a submaximal weight and use that as like an inbuilt mobility sequence in and of itself.
Mm.
So I don't think like weight training should help improve your range of motion. If it's not, you're not doing a very good program, in my opinion. And that might mean doing things that are a little bit unconventional and different to what you're used to. But 100%, there's definitely ways to get stronger but maintain mobility. So
Mm.
it's a hard. I know you like what specific advice do I have for them, but it's like just make sure that you're utilizing a smart training protocol where you are getting into joint positions that mimic your sport. If you're doing knee slices, guard passing positions like that, you need to be able to get that knee over the toe. It doesn't necessarily need to be under load, but these are sort of positions that you need to get into. You need to be able to endure lumbar flexion under load if you're trying to retain guard and things of that nature as well. So it's like these are other things that it's like you need to make sure that the gym stuff that you're doing, you're not restricting your range of motion by trying to just pack on as much weight as humanly possible to where you're just doing like half rep, quarter rep stuff. It's got to be, it has its place depending on what our needs analysis is. But yeah, you need to pretty much work through the ranges that are required for that sport.
Yeah, you nailed it there pretty much. Like strength training is mobility training
Yep,
when you're doing it through the full range anyway. So
exactly.
essentially you're going to maintain or even get more flexible. Like for example, I guess the most common example would be a Romanian deadlift, right?
Mm-hmm.
For the hamstring. So if you do that properly and you're getting good range, you're probably going to become more flexible over time.
Yeah, I think it just comes down to like intelligent training. This could be for like rehab is just training at the end of the day, depending on where people are within their spectrum. All it is like what training can we currently do to help stimulate and create adaptation that isn't causing uh, further tissue damage or aggravating things from a pain standpoint. Where do we want to be, and how can we bridge those two relationships together? Like that's essentially my job in a nutshell. That's what I do.
Yeah.
Yeah.
Oh no, this was a great chat, Mr. Combat Therapist. Since I can't say your name until the reveal. But where can they find you on Twitter? And I'll chuck it in the description too.
Yeah, so it's just the Combat Therapist on Twitter. I may be looking to branch out onto other platforms in the future, but yeah, essentially what I don't just speak about combat sports. A lot of it is the stuff that we have discussed within this talk here as well. So essentially, what I want to do is teach as many people as possible. So I see a lot of physios and health professionals mainly target their information at other health professionals. I think it's much more beneficial to teach the general population. So regardless of if you've had any injury, if you've had any rehab process that you haven't enjoyed, and you want to learn about like pretty much the way that I like to create tweets and information is like a complete no bullshit approach. So giving you like the good things about a certain, this might be a training philosophy, a treatment modality like foam rolling, massage guns, things like that. It's just giving you like the no bullshit approach to it. And that's obviously that's based on my experience as well. I don't have all the answers, but yeah, I'm trying to get as honest and as ethical of an approach to rehab with everyone I work with. So
Awesome. Well, go give them a follow. But thank you for coming on. I really appreciate it.
appreciate it, mate. It's good to talk to you.
Cheers. Nice.